So what do we need to include? Again, we've talked a lot about some of the just basics aspects moving forward. Throughout a lot of information in our previous handouts, we tried to boil it down into a little more a digestible piece again. So the FITT principles, F-I-T-T, FITT principles. F is frequency. This is general recommendations. It's a little bit different for each of us, but for the most part, to achieve optimal health, we need at least 2 to 3 days a week of some resistance work. Resistance work comes in the form of a lot of different options. That can be using weights, that can be using your body, that can be using bands or cable machines, or taking a group exercise class that forces those muscles to challenge themselves. So we want some sort of resistance work, at least 2 times up to 3 times per week. Cardiovascular stimulus, at least 3 to 5 days per week. And we want to not neglect the flexibility aspects. A lot of people tend to overlook that stretching side and the care for those muscles and connective tissues. We got to pay attention to that. Also 3 to 5 days a week of flexibility and soft tissue work, and also strengthening our core musculature. Maintaining a strong frame and torso is extremely important. Also a 3 to 5 day per week. Intensity is the I in FITT. So how hard should you push yourself? So there's a great percentage zone that we can utilize, 65 to 95% of your maximum output. Maximum output can be defined in relative terms, so you can just evaluate yourself, relatively speaking, determine how hard do I feel like I'm pushing myself. Am I at a level 6 out of a 10-point exertion? Am I a level 7, 8? Or do you want to have more absolute numbers, which we can calculate that as well. So a heart rate zone, for example, we can calculate that zone based upon a formula that I'll give you shortly. In terms of flexibility or soft tissue work, we want to move ourselves to that moderate discomfort. So pull to the point of pull in a stretch, not to the point of pain. It's uncomfortable to hold that stretch, but it's not painful. So that's that discomfort. The first T in FITT is type. So what are we doing? The 4 main areas would be a strength, movement, stamina, metabolic, or recovery. There are, of course, several other types of training, but that's your main pillars there. And then the last T is our time. 40 to 60 minutes per week resistance. That's really not a whole lot. Again, 2 to 3 days a week, we're looking at about 20 minutes at least of resistance work on each of those 2 to 3 days per week, so that you've accumulated 40 to 60 minutes total time in resistance work. 75 to 150 minutes of cardiovascular exercise. The more the intensity of the movement, the lower the volume has to be. So if you're pushing yourself pretty hard, just 75 minutes a week. Again, that's a very bite-sized chunk, so long as you're spreading that consistently over the course of your week. If you're not able to push as hard, or you're not able to tolerate that intensity level, you got to go a little bit longer, up to 150 minutes per week. But again, you can accumulate that dose over the course of a day. That's where those 3 and 60s come into play. So maybe one of your 3 and 60s is getting on the stairs, and you're accumulating that, and then another time we're just going to walk laps around the hall. Again, just be strategic in terms of how you get that dose of movement medicine into the course of your day. And then again, our flexibility. We don't want to neglect the integrity of our soft tissue, so we do want to spend some time going through some basic mobility work, some flexibility work for all of our major muscles. So that's our FITT principles. Again, additional principles that we mentioned last time. Obviously, we want to have some variety. If we do the same thing over and over and over again, guess what? You're not going to want to do it anymore. The only thing routine about an exercise program should be that you do it consistently. If it's too routine otherwise and you're doing the same thing all the time, guess what? Burnout happens pretty quick. I'm the same way. About every 2 to 3 weeks, I'm changing my program pretty significantly. And then even some micro changes within the context of a workout. Maybe one set of, say, a chest-based movement would be from a flat angle. And then the second set, you want to have a little bit of an incline. And then the third set, maybe you're going to do a body weight versus a machine weight. So you can have variety within the context of a session, variety within the context of a training week and a training month, a training year. We just want to give ourselves something fresh every so often to keep yourself moving forward. Obviously, progression. Again, we've got to consistently challenge ourselves to do more than we're accustomed to, or else change doesn't occur. And then, of course, recovery, very important. We've got to give ourselves a stimulus to change, which is our movement program, but we've got to also have time to recover so that we can actually adapt to that program. So recovery is just as important in balancing a good overall program.